Hey there, welcome back to HealthCap Weekly Wrap. You know, just when you think you've heard it all, another week rolls around with more headlines that make you sit up and take notice. And let me tell you, this week is packed with stories that matter to senior living communities.
Yep. From new backup generator rules that could be a game changer for emergency preparedness to the latest updates on HIPAA regulations, we're covering it all. Plus, some big medical breakthroughs, from a new PTSD treatment option to a tool that can predict the onset of Alzheimer's.
And of course, we've got some critical healthcare insights, including why getting sepsis right is more important than ever, and a special report that's raising eyebrows across the industry.
So whether you're on your morning commute, sipping that first cup of coffee, or just taking a break between tasks, stick with us. Let's dive in.
Let's start with some breaking news that's making waves in the healthcare community. A recent court ruling has ordered the CDC and FDA to restore previously removed web pages and data. This decision emphasizes the importance of transparency and access to information, especially for healthcare providers and the public.
That's right. MedPage Today reports that the ruling stems from a lawsuit arguing that removing these pages limited public access to critical health data. The court's decision highlights the role of government agencies in maintaining transparency, especially when it comes to healthcare guidelines and public safety.
For senior living communities, staying informed with the most up-to-date data is crucial for making informed decisions about resident care. This ruling reinforces the need for transparency from our health agencies.
We'll continue to monitor this situation and provide updates as more information becomes available. It's essential for all of us in the healthcare sector to stay informed about these developments.
Moving on to other news, there's a significant update from Texas. Harris County has passed a requirement mandating that senior living communities must have backup generators capable of providing heating and cooling during emergencies.
Yeah, and honestly, this feels like one of those "why wasn't this already a thing" moments. We've all seen what extreme weather can do, and when the power goes out, residents in senior living communities are among the most vulnerable.
No surprise there. The county says this new rule is in direct response to past disasters. Think back to Winter Storm Uri in 2021, when millions of people lost power, including senior communities that were left scrambling to keep residents warm.
Right. And while some communities already have backup power, this new requirement makes it mandatory. It's not just about keeping the lights on, it's about maintaining a safe environment. Heat waves, winter storms, hurricanes, you name it, and senior living communities have to be ready.
The big question, of course, is how will this be enforced, and how long do communities have to comply? Officials say there will be a phased rollout, giving communities time to install the necessary systems.
But it won't be cheap. Generators capable of handling heating and cooling require serious investment, and not every community has the budget for it. That's where state and federal funding might come into play.
It's a smart move for resident safety, but it's also a major financial and logistical challenge. We'll be watching to see how this plays out and whether other states follow Harris County's lead.
Yeah, because let's be honest, Texas isn't the only place dealing with power outages. This could set a precedent for more widespread regulations in the future.
All right, coming up next, HIPAA is making headlines again. If you handle resident records, you'll want to hear about these new privacy regulations. Stick with us.
New regulations are on the way, and if you handle resident records, now's the time to pay attention.
Yeah, and let's be honest. HIPAA is one of those things you don't think about much until there's a problem. These new updates are meant to modernize privacy protections and make sure health data is handled appropriately, especially with all the changes in telehealth and digital records.
One of the biggest updates? Stricter rules on how personal health information is shared, particularly when it comes to third-party access. There's also a push for greater transparency, so residents or their families will have an easier time accessing their own records.
That's a big deal, especially in senior living, where families are often navigating complex care decisions. But along with more transparency comes tighter security requirements. So if your community hasn't reviewed its policies in a while, now's the time.
And let's not forget enforcement. Regulators are cracking down on non-compliance, so those "we'll get to it later" security gaps, yeah, those could end up costing you in fines.
Bottom line, this isn't just another policy update. These changes impact how senior living communities manage data, communicate with families, and protect resident privacy.
If you haven't already, take a close look at your current HIPAA protocols. Make sure your staff knows what's changing and, if needed, get some training in place. It's always better to be ahead of the game than playing catch-up.
All right, coming up next, there's a new treatment option for PTSD, and it's showing some serious promise.
Yeah, this is huge. PTSD has been notoriously difficult to treat, with many people struggling to find relief even with therapy and medication. But the latest research is looking at a new approach that could change that.
The FDA just approved a medication called MDMA-assisted therapy for PTSD, and studies show it significantly improves symptoms in people who haven't responded to traditional treatments. It's a big step forward in mental health care.
What's different about this treatment is that it combines MDMA, a drug you might recognize as ecstasy, with psychotherapy. The idea is that the medication helps patients process trauma more effectively in a controlled setting.
And before anyone jumps to conclusions, no, this isn't just handing out a party drug. The therapy is highly regulated, done under professional supervision, and has shown better outcomes than many existing treatments.
That's key because PTSD isn't just a military or first responder issue. It can affect anyone, including seniors who've experienced trauma earlier in life, caregivers dealing with burnout, or healthcare workers who've been through high-stress situations.
More research is still needed, but this could be a major breakthrough. If it's widely adopted, we might see a shift in how PTSD is treated, especially for those who've struggled with traditional options.
Let's talk about sepsis. It's one of those conditions that everyone in healthcare knows is dangerous, but new research is showing just how much early intervention matters.
Yeah, and the numbers don't lie. Sepsis is still one of the leading causes of hospital deaths, and for residents in senior living communities, it can escalate quickly. The problem is, diagnosing it correctly and treating it fast enough is a real challenge.
That's where this new research comes in. A recent study is highlighting just how often sepsis is misdiagnosed, either because the symptoms mimic other conditions or because treatment protocols aren't being followed consistently.
The study points out that early warning signs like confusion, rapid breathing, or sudden weakness can be missed, especially in older adults, where those symptoms could be attributed to something else, like dehydration or a urinary tract infection.
And missing it, even by just a few hours, can mean the difference between recovery and serious complications, or worse. The key takeaway here is that healthcare providers need to be trained to recognize subtle signs early and act fast.
Right, because once sepsis takes hold, it can lead to organ failure in a matter of hours. The study suggests that standardized screening tools and more aggressive early interventions, like starting antibiotics immediately, could significantly improve survival rates.
The challenge is that sepsis protocols aren't always followed the same way across different settings. Hospitals have strict sepsis management guidelines, but in senior living communities, it often falls on caregivers to notice those early warning signs and push for quick action.
That's why education is so important. If you want to dive deeper into early detection, HealthCap has a free webinar on recognizing the early signs of sepsis, plus several downloadable resources in our Resource and Education Center. Making sure staff knows what to look for and when to escalate care could be life-saving.
Speaking of conditions that benefit from early detection, JAMA Network Open recently published a study on a new tool that could predict when someone might develop mild cognitive impairment or Alzheimer's disease.
This is big news, especially in senior care, where early diagnosis can make a huge difference. The study introduces what researchers are calling the FDI, basically a prediction tool designed to estimate when someone is likely to develop mild cognitive impairment or Alzheimer's.
Right, and what makes this different from other assessments is that it uses a combination of genetic, lifestyle, and health factors to generate a personalized risk estimate. It's not just looking at family history, it's taking a more comprehensive approach.
And that's important because while Alzheimer's doesn't have a cure, catching it early gives residents and their families more time to plan, consider treatment options, and make lifestyle changes that could slow progression.
Exactly. The study suggests that this tool could eventually be used in routine screenings, helping doctors and caregivers get ahead of cognitive decline rather than reacting after symptoms become severe.
But there's still a lot to figure out. How accurate is it in real-world settings? Will it be accessible to everyone? And of course, how will communities and healthcare providers integrate it into care plans?
Those are the big questions, but the potential here is huge. If this tool proves reliable, it could help caregivers take proactive steps to support residents before cognitive decline affects their daily lives.
We'll be keeping an eye on this one. Alzheimer's research is moving fast, and anything that helps with early detection is worth watching.
Now, shifting gears a bit, MedPage Today just released a special report on a growing concern in healthcare, and it's something we can't ignore.
Yeah, this one dives into the increasing pressures on healthcare workers and the ripple effect it's having on patient care. Burnout, staffing shortages, and ethical dilemmas are all piling up, and senior living communities are feeling the strain just as much as hospitals.
MedPage Today highlights that staffing issues aren't just about numbers anymore. It's not just that there aren't enough caregivers. It's that the ones who are still in the field are stretched thin, dealing with higher workloads, more complex resident needs, and increasing regulatory demands.
And that's leading to some tough situations. The report highlights cases where workers feel forced to cut corners, make difficult medical decisions under pressure, or even leave the profession entirely because they can't keep up.
Which is a huge problem for senior living communities. When staff is overwhelmed, resident care suffers. It's not intentional, but mistakes happen, and even small oversights can have serious consequences.
Exactly. MedPage Today also points out that this isn't just a short-term issue. If these trends continue, we could see a major crisis in care quality, with fewer experienced professionals in the field and more communities struggling to meet basic care standards.
So what's the solution? That's the big question. The report suggests that while better wages and benefits can help, what workers really need is more support, better training, realistic staffing ratios, and policies that don't push them to their breaking point.
And that's something senior living communities can take to heart. Investing in staff isn't just about retention. It's about maintaining the level of care residents deserve.
Right. And for anyone working in this space, this report from MedPage Today is a must-read. It really lays out the challenges ahead and why we need to start thinking about solutions now, not later.
That wraps up this week's episode. We covered everything from new regulations to medical advancements and the challenges facing healthcare today.
If you want to dig deeper into any of these stories, check out Angie's weekly wrap blog on our website at healthcapusa.com. You'll find more details, resources, and links to all the reports we covered today.
Thanks for listening, and we'll see you next time.